1 in 9 people over the age of 65 has Alzheimer's disease, and the number of Americans living with Alzheimer's is growing steadily as our population ages. Hi, I'm Dr. Teresa Gomez-Isla, Director of the Massachusetts General Hospital Memory Division. So, what is Alzheimer's disease? Alzheimer's disease is the most common type of dementia. It gets worse over time, slowly destroying the brain's ability to think and remember. We believe that the brain changes that characterize the disease may actually start up to 15 years before people notice any symptoms. We don't know exactly what causes Alzheimer's disease, but we suspect that the causes include a combination of age-related changes in the brain, genetic, environmental, and lifestyle factors. The importance of any one of these factors in increasing or decreasing the risk of developing Alzheimer's may differ from person to person. What are the symptoms of Alzheimer's disease? Short-term memory problems are usually the first thing people notice. People may struggle to remember recent conversations and events, or may have problems losing or misplacing things. Other Alzheimer's symptoms include poor reasoning and judgment, losing track of dates or knowing current location, language problems, including difficulties naming familiar objects and people, difficulties performing simple tasks, or changes in mood, behavior, or personality. If you experience any of these symptoms or notice them in a loved one, it is important to make an appointment with a primary care physician who can perform a physical exam and refer you to a memory specialist if needed. Alzheimer's disease shares symptoms with other serious conditions, including blood clots, head injuries, and issues with the kidneys, thyroid, or liver. The only way to know what you are experiencing is to get checked out. Is there a screening test for Alzheimer's? We don't have yet a single test for Alzheimer's. However, a combination of diagnostic tests and imaging help us make an accurate diagnosis. We may conduct mental and neuropsychological tests to look at your memory, problem-solving ability, orientation, and language, among others. We may also use brain scans like an MRI or a CT to look for other causes of your symptoms. We may also order an amyloid PET scan or perform a lumbar tap to detect the lesions in the brain that characterize Alzheimer's disease. How is Alzheimer's disease treated? Currently, there is no cure for Alzheimer's disease, but we have newly approved drugs that help lower the amount of amyloid plaques in the brain and may slow the progression of the disease. We also have medicines that may help boost mental function and relieve symptoms. Other factors may make it easier to manage Alzheimer's disease, including a healthy diet and regular exercise that can improve memory and reduce anxiety and depression. Socialization or engaging with others may slow cognitive decline and keep the brain more focused. A calm environment can help patients feel less agitated. Caring for somebody with Alzheimer's is very challenging. Support groups for family members and caregivers and social services consultations can help improve the quality of life for the caregivers and the patients. While we can't yet cure Alzheimer's, we are conducting clinical trials of new treatments that may also give you and your loved one access to the latest potential therapies being tested to stop or slow the progression of the disease. We are also researching ways to prevent the disease before it even starts. Please know that you are not alone. With a caring team by your side, you and your loved ones can face this challenging journey with support, comfort, and understanding. Thanks for watching. I'm Dr. Teresa Gomez-Isla. To learn more about memory disorders, click here. And don't forget to subscribe. Thank you.